Welcome to the first People's Health Briefing of 2022. I'm Dr. Noha from Roots Community Health Center reporting for the week of January 10th. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please feel free to submit your questions in the comments by direct message or email us at admin@rootsclinic.org. COVID-19 and specifically Omicron is truly surging here in the United States. We are already breaking records. Unfortunately, this past Sunday, we broke our hospitalization record, exceeding the record that was last seen on January 14th, 2021. So we were up over 142,000 people hospitalized with COVID-19, and we are just getting started on this surge, so it definitely is very concerning that we have already broken last winter's record. The 7-day average of daily hospitalizations is also markedly increased by 83% compared to a couple of weeks ago. Deaths continue to be high, over 2,000 on some days. And remember that this doesn't yet reflect our current surge, and it's probably reflecting more of the sort of Thanksgiving and holiday time frame. And here in Alameda County, you can see here that cases are sharply rising. This is a new representation. The county is showing it a little bit differently. So this looks a little different than what you may have seen before, what I've shown before. You can see that to the far right, the light gray vertical lines there are actually incomplete data, meaning they can only kind of go up from here as cases are updated over the last several days. But still, you can see that even though it's not even a complete data set, it is still markedly increased and just taking a very steep, sharp rise there. And when we look at the rolling 7-day positivity rate, it has really taken a huge jump. It's never been this high. It's 18.2% positivity rate, and the World Health Organization has set that we'd like to be below 5% to show that we are actually testing enough people to get an adequate sense of what is going on. So this is just literally pretty much off the charts here, and it just lets us know that things in terms of cases are very high. But we know that because this new variant, the Omicron, can infect people who are vaccinated, what we're really interested in is those severe outcomes. And so far, what we're seeing is unfortunately also a significant increase in hospitalizations. We've already exceeded anything that we had in the summer surge and are well on our way to a significant winter surge. And so you'll see here that the last day reported was there were 307 people hospitalized with COVID-19 and 42 people in the ICU. And if we compare this to just before the Thanksgiving break, there was only 43 in the hospital and 11 in the ICU. So hospitalizations are now about 7 times what they were right before Thanksgiving break, and about quadruple folks in the ICU compared to right before the Thanksgiving break. So this is unfortunately not good news, that hospitalizations are rising very sharply right along with cases. And the state of California has been reporting on this very helpful metric. I put the link in the notes so that you can check it out. They show cases, hospitalizations, and death here. What I'm showing is that for those who are not vaccinated in the state of California have been shown to be 16.6 times more likely to die from COVID-19 than fully vaccinated people, and this was the week ending December 12th. Similarly, what we saw with hospitalizations is that those who are not vaccinated are about 10 times more likely to be hospitalized. So really, it's very, very clear, sort of hands down, the folks that are having severe outcomes are still those who are not vaccinated. And one thing that was shown this past weekend in the New York Times, they were looking at a few different cities that have been hit hard by Omicron or hit early by Omicron: New York City, DC, and Chicago. And all of them have sharply increasing cases. But what I wanted to show here is that similarly, we are seeing just a very sharp rise of people going to the hospital, people going to the ICU, and people being on ventilators. And so this is all very, very concerning. And I'll talk a little bit more about how to sort all of this out and kind of reconcile this with some of the narratives that we've been hearing out there. First, I wanted to just get a couple things out of the way because I've gotten a lot of questions about this. Is it, I hear people saying, do you have COVID or do you have Omicron or do you have, and now we're hearing about Deltacron and Flurona. And so I just want to hopefully bring a little bit of sanity to this conversation for a moment. I'll just get Flurona out of the way. It's not new or unusual for someone to catch two respiratory infections at the same time. They're spread the same way. So if you're, exposed to one thing, you could be exposed to more than one. And sometimes we do panels where we're looking at a lot of different respiratory infections, and it wouldn't be unheard of to have two happen at the same time. This doesn't seem to be very common that someone gets infected with the flu and with the coronavirus at the same time. It can happen. There's been a couple of cases reported. I don't think that we should be putting this word together like this, Flurona, because it kind of makes it seem like it's its own entity. It's not. It's just someone caught both at the same time. So let's not get it confused. At least so far, we don't really see a way, shape, or form for these two things to combine, activate, and become a new pathogen. So for now, it's just a few unlucky people caught both. So, if you haven't gotten the flu vaccine, now will be a good time to get it. Getting the flu is no fun. Getting the flu when the hospitals are overrun is definitely a concern. And getting the flu and getting COVID at the same time also does not sound fun. Although to date, we don't really have any evidence that it's actually necessarily going to be worse on your body than getting one or the other. It's sort of, it can kind of go either way. So hopefully we can just remove this from our vocabulary. Likewise with Deltacron, there were some reports coming out of Greece about this potential of the two, Delta and Omicron, kind of combining to create a new mutant, super mutant. It could well be from contamination. We really don't have all the data yet. There's some evidence pointing to that it may have been contamination, which wouldn't be unheard of either. So I just really trying to say, let's not jump on these bandwagons and run with these things. It's pretty easy to get overwhelmed with everything that's going on. And I'm just going to say that the reality that we're in of Omicron is chaotic enough. So I think we can sort of not right now, we don't have to worry about all these other outlying things. I think we have enough to be legitimately concerned about. So what is the story with Omicron? And I think one of the things that I just really want to say about it is that I am concerned about sort of this continued narrative about Omicron being milder. I totally get that we want it to be milder. And that there have been all these trickling in pieces of information that make folks want to say that it's milder, but we really have to stay clear about this. And I think it's really critical, particularly for those who are vulnerable among us. And that really includes those who are not vaccinated. It includes those who may not have mounted a good response to the vaccine, or those whose response may have worn off by now. So that's potentially a lot of people. It's everybody under 5. It's everyone who's chosen not to get a vaccine up until now, and it's those who are immunocompromised and who may not have mounted a good response. It includes a lot of our elders, and it includes a subset that we may not even really know if we mounted a great response to the vaccine because we still don't have a great way to test for that. So in that group of people that I just described, that whole group of people that may not be protected by the vaccine for one reason or another, there's absolutely no evidence right now that Omicron is going to be milder for them. And that's who we're most worried about. So it's a really harmful narrative to be saying, oh, it's mild, I'm vaccinated, it's mild. That's not right. And it's actually really unfair to everybody else to be spinning that narrative, because it makes things even more unsafe for those people. And so, what do I mean by that? You hear people saying, oh, the hospital has all these people who caught Omicron, but the disease isn't as bad. Or even people themselves saying, oh, I caught it, but it seems pretty mild. Well, a lot of that is talking about vaccinated people. We can't confuse the vaccinated people with the unvaccinated people. Because remember, if you're vaccinated, if you got exposed to Delta, you probably wouldn't have got anything at all, let alone something mild. So now you're comparing something mild to not having gotten anything at all with Delta. So it's not more mild, it's worse. It avoided your prior immunity. So it's really concerning, because so far we actually don't have any solid evidence that would tell us that for, let's just say, an unvaccinated person, that their risk is lower. And in fact, right now might be one of the most dangerous times there's been for an unvaccinated person. Why? Because it is really circulating out here. COVID is really circulating out here. It is very transmissible. Even vaccinated people can transmit it if you are vaccinated. And a lot of the precautions and mitigation measures that we've taken in the past, like 10 days of isolation, are falling by the wayside. So that is less and less protection for those people who are unvaccinated. And as I've said, I have not seen any evidence to suggest that if you are unvaccinated, Omicron is milder. And in fact, there's some concern that it's actually that it may even be worse. We actually don't know. We are seeing children who are unvaccinated dying at a higher rate than we've seen in this entire pandemic. And this is primarily unvaccinated children. And so that would seem to suggest that it is actually maybe even more dangerous. So we just don't know yet. The other sort of hopeful thing that I think people wanted to hang their hat on was in these animal models, Omicron didn't go as deep in the lungs. It was mostly in the nose and upper airways. And once again, first of all, we're not hamsters. We don't know if that translates into human beings. And we don't know what it means clinically. So we need to wait and see, because remember, like I've said so many times on here, COVID-19 is not just a respiratory issue. It can affect just about every organ in the body. So we really have no idea. Are we going to see more clots? Are we going to see more strokes? Are we going to see more neurological issues? These are all things we've seen with COVID-19. So you saying, oh, a hamster had it more in the nose and then the lungs, yeah, I get we want to take that and run with it and think that that means, okay, great, it won't be as bad. But we just don't know yet. We just have to wait and see. And I think what I am mostly concerned about is the level of chaos and the level of, and sort of a lack of discipline, I will say, about really about what we're saying, the narratives that are coming out in the media and elsewhere, and even just the anecdotal stories that we're hearing. There's a time and a place for anecdote, but when we are on this level of a situation that is really kind of going out of control in terms of number of cases, we want to be very, very disciplined about what we're saying. So we can't mix up vaccinated people and unvaccinated people and then just call it milder. You have a whole bunch of vaccinated people that got infected that would have never gotten infected before, who are doing better. So I think that the silver lining in it is that, yes, if you are vaccinated, you do have protection. It's not the level of protection you had before with Delta by any means. You can still catch it. And the booster does appear to be the best way to get those defenses back up to a level that is more significant. And so that is the recommendation. Um, in fact, that recommendation has changed a bit, and is now shortened to 5 months for a booster for Pfizer. And so I think the takeaway point with it is that if you've had your 2 doses, it's been more than 5 months, 6 months, it's time to get it. Primarily because of Omicron, right? This isn't just because you have less immunity against Delta. Delta's kind of yesterday's variant now. And so it's really because Omicron is avoiding or evading our prior immunity, and that is the reason why the booster is needed. But among those who are unvaccinated, the risk is still there. It's still high. It may even be higher, as I said, because there's more likelihood of being exposed to it. It's just circulating so much more. And there's absolutely no reason for us to think that it's going to be milder in an unvaccinated person. And again, very concerned about our children. Seeing the rise in hospitalization and the rise in deaths among children is absolutely devastating. We don't see children in this country dying of respiratory illnesses, infectious diseases like this. It is always a tragedy to lose a child, but normally we lose a child to an accident, to cancer, to some other kind of chronic illness, but not a essentially vaccine preventable illness. So I know that we are all looking forward to the time when the under 5 vaccine is approved. But also, our vaccination rates among the 5 to 11-year-olds still are lagging behind. So, even in this county where we are doing really well, it is still significantly lower, under 50%, for the 5 to 11 age group. So, we really do want to urge that you consider getting your child vaccinated to protect them, because this is absolutely highly contagious. It is all around us, and those who are having very severe outcomes are those who are unvaccinated, and that is just as true today as it was with Delta. So, how can we find some sanity in all of this chaos, and what can we do, given that we are in sort of this precarious moment where we have cases that are going through the roof, we have hospitalizations following behind, and we anticipate deaths following right behind that. And at the same time, we are having sort of some 2020 like situations with resource shortages, insufficient testing capacity. Can't believe we're saying this in 2022 that we have insufficient testing capacity, but that is a fact. Lines around the block again, labs getting backlogged, turnaround times getting longer again. So, what can we do? And I think that we need to take a breath and we need a strategy. Ideally, a global strategy, at least a national strategy, but some kind of a strategy to guide how it is that we can use the resources that we have in the most optimal way. And in the absence of that, I think we just all have to be as conscientious as possible and think about whether do we really need to be in that line for that PCR test or not? Or should we be doing a home test? Or should we be waiting and doing something else? And so I'm going to walk us through a little bit of that now. And so I think the one piece that is going to be the biggest determining factor on what test you need is how is it going to change your behavior. And when I say that it would be nice to have a national strategy, it would be to do things like maybe we need to reconsider, requiring a PCR before you go on certain flights, for example. Because really, as we've talked about here before, a rapid test is going to give you more information. If you do rapid tests right before you get on the plane, the chance that, and it's negative, the chance that you become infectious during the flight, is probably pretty low. However, if you get a PCR test 72 hours in advance, the chances that you caught COVID after that, it's definitely possible. So I think we need to rethink how we are distributing our resources, because it is a little bothersome that this gold standard PCR test is essentially being taken up and being used for things that where it may not be the most advantageous, and that we aren't using the antigen test, which can have a good type of information to assist us. I still see a lot of confusion. So here is a simplified representation of when these tests are going to actually detect that you have SARS-CoV-2. So if you get infected down there where it says 0, after a couple of days is when the virus starts to replicate and the virus concentration starts to go up. And early in those days, the PCR test will actually pick up that you have SARS-CoV-2, because remember, PCR is going to keep amplifying the specimen and take what is even a tiny, tiny amount and show it. And so the PCR test is going to be more useful in those very early days after you catch SARS-CoV-2, before the antigen test will turn positive. Now, a couple days later is when you may get your symptoms. So the PCR test is going to be positive even before you start with symptoms. So this could be helpful if you know you were exposed. If you think you were exposed, the PCR test is going to turn positive sooner than the antigen test. Now, right around the time that you are getting symptoms is the time when the antigen concentration is going to be going up, and your antigen test is more likely to be positive. So the antigen test is going to be positive typically around the time that your symptoms start. And it's going to tell you that you are contagious, because remember, the antigen test is going to pick up when you have a large amount of the antigen in the nose. And so if you are just getting symptoms, the antigen test is actually not a bad test to take. Why? Partly because if it is SARS-CoV-2, you got a pretty good chance of it being positive. Also because if it's positive, you can believe it. You really don't have to do anything more, except in a couple of situations. I'll mention that in a moment. And because you don't have to leave your house, you're not feeling well, you don't need to be standing in a long line, or trying to run around feeling sick when we have all these testing shortages. If you have a test at home, you take the test, it's positive, believe it. And so the antigen test is going to be positive sort of for a shorter time frame, but it's during the time frame when you are most likely to be contagious. And as you can see here, that PCR test is going to continue to be positive for quite some time. We've seen people even have a positive PCR for a month or more. And so please do not get a PCR test after you were already positive. There's just no reason. You're taking up a resource. Tell your boss, tell the school, this is not how we do it. We still sometimes have schools and employers that think they need to see a PCR test turn negative before you can return. This is a terrible use of the PCR test. It's very unfair to the individual who is kept from activities when they're not even contagious. And it is just an inappropriate use of the PCR test, like some other ones, like maybe even travel, 72-hour PCR test before travel. I mean, you can catch SARS-CoV-2 in those 72 hours, so it's probably not that great. I would actually rather see a negative antigen test right before you get on the plane, because probably for the next few hours you're not contagious. So I think, again, we need sort of this strategy that's going to help us really kind of most appropriately use each of these tests for the best situation. So in general, if you're about to head into a gathering, antigen test is a pretty decent test to do. If it's positive, you can believe it. The antigen test is very helpful if it's positive. If it's negative, not so much. You have to repeat it. And so it really only gives you maybe a day pass, maybe a half day pass if it's negative, but you should repeat it if you're going to continue gathering. If you think you were exposed, then really this probably, which test you get probably depends on how the test result is going to change your behavior. If you, let's say, are able to isolate, you can work from home, you feel fine, you just know that you were exposed, then you can just go ahead and isolate, or quarantine in that case, because you don't know if you're positive. So you can go ahead and quarantine. You can do the antigen test after 5 days. Then you can repeat it again a couple days later. Couple antigen tests, 48 hours apart after that 5-day period. And you're negative, then I think you're done. But let's say you were exposed, but you care for an elder grandparent, let's say. Then that's different, because you really kind of want to know if you have it, or else you can't go around them, and maybe that is your role, is to care for them, and that their care will suffer if you don't. So in that case, getting the PCR test a few days after you're exposed. Now remember, with Delta and its other ones, we used to say 5 to 7 days. Now it looks to be shorter, so we're saying around 3 to 4 days. Go ahead and get tested after exposure. So if you really, really need to know, and it is going to change your behavior, then go ahead and get the PCR test. If you can go ahead and isolate regardless and not go around vulnerable people and take your time and be on your own quarantine and get the antigen test, then you probably don't need to be standing in that long line for PCR. If you have symptoms, this is another time when I think the antigen test can be helpful, because as we saw, when you have symptoms, you are pretty likely to test positive. It's definitely not perfect. And so if you have symptoms and it's negative, you should quarantine yourself and repeat the antigen test. Or you can go ahead and get the PCR. Now, how do you make that decision? Well, again, is it going to affect your behavior? If you're in a high risk category and you getting the test is going to be the difference between getting treated or not, then I would recommend that you get a PCR, because usually a treating facility is going to want to see that you have a PCR just to be absolutely certain that that is your diagnosis before you get, let's say, an infusion treatment, or maybe even the new pill treatments, which are in very, very short supply. So if you're over 65, you have underlying conditions that make you at risk of doing poorly from COVID-19, you're unvaccinated, all of those things make you at very high risk of very poor outcomes from COVID, then in that case, you probably do want to get that PCR, which is a confirmatory test. You don't need to do any more tests. If the PCR is positive, then you would be eligible. Now, the problem is the PCR test could be positive for a very long time, so it's not going to tell you if you're contagious. So again, you see that these are two kind of different uses for the test. They tell you different things. They both have their own imperfections. The imperfections are different from one another, so it's no wonder that all this is confusing. The last scenario I'll talk about is if you're recovering from COVID. So this one has been coming up a lot. I've been getting tons of questions about this, primarily because the CDC went ahead and changed the guidelines. I talked about it in a little bit of detail in the briefing 2 weeks ago. But basically, the guidelines have changed to 5 days after you've caught COVID, you've started symptoms, you've tested positive, that the isolation period was shortened to 5 days. And as I talked in some detail last time, this makes me nervous. There's no magic that says on day 6 you're not contagious. So no matter what you do, if you're going to go out, please wear a well-fitted N95 so that you don't get other people sick. But what would be even better is to take an antigen test, not a PCR test, an antigen test, because that's going to tell you if you still have a lot of the antigen in your nose and if you are likely to spread it to someone else. And so if it is positive on day 6, then you stay isolated. If it's positive on day 7, day 8, you stay isolated. And so I would suggest waiting until you have a negative antigen test or 10 days have passed, and then you can end your isolation period. But I would still be wearing that well-fitted N95 mask, just simply because this virus is so contagious and we don't want to give it to anyone else, especially those that are vulnerable. And once again, there's absolutely no reason to PCR test again in this situation at all. And the other thing I'll just throw in there, because I've just been seeing a lot of just panic and chaos around not being able to get access to a test. We're hearing that some places have test appointments 2 weeks out, which really is not very helpful. It's only going to be helpful for situations where I don't think you should be getting a PCR anyway. Like I say, getting on a plane 72 hours ahead or whatnot. So planning a test 2 weeks in advance kind of doesn't make any sense. Because if it's because you're trying to go visit someone, etc., then the antigen test is probably going to be a better indicator anyway. But I will say that, let's say you don't feel well, you wake up with a sore throat, you take your antigen test, it's positive. You do your isolation period, you turn negative on day 7, you end your isolation period, but you just really want to know if you had COVID. You're just super curious. Well, then you can go ahead and get the PCR after that. It's no big rush. It's probably going to be positive for a whole month anyway. So if you're just really super curious, you can always just wait until your isolation period is over, wait until you're feeling better, You've been fever free for over 24 hours. You end your isolation. And at that point, if you really want to get a confirmatory PCR test just because you feel like you want that documentation, then, like I said, it's probably going to be positive for a whole nother several weeks anyway. So you could just go ahead and get it then. It's really not needed. Probably not a great use of the resource, but I do understand that some people need documentation for different reasons. And so at this point, with scarce resources, I think it is incumbent on each and every one of us to just be as conscientious as possible about when we really need which type of test. And even though the antigen tests have been in short supply so far, hopefully, we will be seeing more of them in the community very soon. I think it is a tool that every single one of us needs in our toolkit. Every one of us should have these at home if possible, especially those who are unvaccinated and who are at high risk. And once again, I'm just going to stress that if you are a person who would be eligible for treatment, you are the one that I want to get a PCR test as soon as possible, because for some of these treatments, like the pill, the Paxlovid, which is available, just very scarce, we have to start it in 5 days, and actually the sooner the better. So especially if you're unvaccinated or if you're in a high risk category and you were exposed or you get symptoms, please just go ahead and get tested as soon as possible at the PCR test. And that is probably the highest best use for the PCR, is if it is going to enable or guide treatment, life-saving treatment. Now that is a good use for the PCR. Some of these other uses to go gather after you've been infected, these don't make sense. And in those cases, we really want to be thinking about the antigen test. So that is just some food for thought while we are in this unfortunate situation of resource shortages for testing. And hopefully this is going to sort itself out soon. But 2 years in, yeah, it's frustrating for all of us. So I think I'm going to end on what I hope is a positive or hopeful note, which I think is really just to say that we need to have a strategy that goes beyond testing, it goes beyond vaccines, and it really is thinking much more broadly about what is needed. Because there will become a time where we have great treatments. It's close, it's within reach. Unfortunately, it's going to get worse before it gets better. And I do think we all need to be in the reality, embracing ourselves, that we still have a tough, at least few weeks ahead of us. We are going to lose people, especially those who are unvaccinated. And so, anybody that we know, if you're over 40 and unvaccinated, I'm worried about you. And I hope that if you have loved ones who are especially over 40 and unvaccinated, but really any age, especially with underlying conditions, I am worried about you. And we should be worried about our family, our loved ones who are still remaining unvaccinated, because they are in the greatest danger now. They may even be in greater danger now than they ever were. And so, and especially if we start to have hospital capacity challenges, as many parts of the country are having. And so, really just need to urge folks to reconsider. Now's the time. We've had enough time to see the safety of these vaccines, and we are seeing that they are doing their job of protecting against the most severe outcomes. So that is really who we need to be concerned with. And what we are seeing now is that there are several groups of experts, of physicians, epidemiologists, and others that are putting out calls to action that I think are very sane and very practical and reasonable. And I put links to them in the post. The first one is really a global call to action for Vaccines Plus. And they basically are saying, look, we have to, first of all, be clear that COVID is airborne and we need to treat it that way. We need to be therefore using high quality, high filtration masks like N95s in any high transmission setting, in any indoor gathering. We need to have effective ventilation and filtration strategies. We need to have criteria of what to do when we go through surges. How do you relax and impose measures based on how much community transmission there is. And we have a little bit of that, but it's probably not a thorough, global or national standard in that regard. We need to test and trace and isolate and support, and we need to do that more when there's higher transmission. We need to break those chains of transmission. And then last but definitely not least, we need to advance global vaccine equity, which means sharing vaccines, sharing patents, and removing barriers to technology transfer. My second favorite one was published in JAMA, and it was really about a national strategy. And this was basically calling on this country to do a better job of collecting data, not just on SARS-CoV-2, but all respiratory illnesses, to improve our technology, improve our data collection techniques, improve our surveillance so that we don't get hit upside the head with another variant unknowingly, that we're prepared ahead of time, and that we really put in place strong mitigation strategies, masking, distancing, and ventilation, and that we have clear guidance coming nationally about all of these things. And so I would encourage you, particularly if you are feeling hopeless or like it's just too chaotic and crazy, I think these are two short, grounding documents that I think we could all learn from. And I think that in the meantime, we need to understand that we do have, unfortunately, an unprecedented surge of cases right now. So you are going to know people who get it. But it's not inevitable that you get it. There are the same ways that we could protect ourselves against Delta, we could protect ourselves against Omicron. And so that means all of the things that I've already discussed, a high filtration mask, good ventilation and filtration are absolutely critical. We're going to use our testing strategically, and we're also going to do our best to eat a balanced diet, get some exercise, take multivitamin, consider additional vitamin D supplementation, keep your stress levels down, and get a good night's sleep. Thank you for joining us, and we'll see you next Tuesday at 10 a.m. See you then.